success story of all this is the NHS wasn't overrun, didn't need to use those extra hospitals and so on. No, because they put everybody into the care homes where everyone's now been dying. I've already had one friend whose mother died in a care home. Somebody else then contacted me. And then last night I got a friend in the TV business who I've worked with. I wanted to share with you. She's posted some stuff on social media, so I'm not revealing any secrets here. My mum passed away on the 2nd of May from COVID-19. She was a patient in a care home. She had an underlying condition. Obviously, it's heartbreaking, but I'm also so angry that she and thousands of others were just left, discarded, as the old and the ill, when in fact my mum was severely disabled by her illness, but could have lived for another 10 years or more. Why was her life worth any less than yours or mine? And there's this ongoing thing, which a lot of young people have sort of bought into. This only kills the old and infirm. It's just somehow these lives matter less. They don't. No. These are people, including the D-Day veterans. On VE Day, we celebrated all the veterans, didn't we? And we say these are the greatest Britons that are still alive.
Well,
Many of them are in care homes.
I don't know why I'm defending this, really, because I agree with you that every life that is lost is a tragedy to an acute infection, which we are learning more about all the time. However, I would ask, what was the best alternative for elderly patients to stay in hospital in a pretty dangerous environment that we've had, or to go to a care home where the staff are very well trained to look after the patients as best they can.
But they weren't trained.
With
well, let me jump in again, Hilary.
They
were not trained to deal with people with COVID-19.
Nobody is.
They didn't have the protection to do it. No, but by April the 15th, we had these field hospitals.
But was hospital a safer environment?
Well, what about the Nightingale hospitals that were built that weren't being used? Well, why didn't you send them there?
Because we don't have the staff that normally deal with elderly people who need different kinds of attention to younger patients. We're not at the Nightingale. The Nightingale was set up specifically to deal with COVID-19 patients.
Put in people who are trained. I mean, we've got hospitals not being used, completely empty, and we're sending back elderly people with the virus without being tested into care homes, and we now have an epidemic, a second front of this, sweeping through care homes.
We've got a couple
to me, that is negligent.
But they were always, going to be more vulnerable.
A couple of people on the iPad, Hilary, getting in touch. Julie says, doctors are not visiting our care home. Don't know whether Julie works in a care home or whether she has a relative there. Tracy says, I have not seen a GP in my care home since lockdown.
This is what the registrar told me, that they know, because they have to deal with the GPs. And they know a lot of GPs are simply not going to many of these patients before they're dying, which means they can't test them for COVID-19, which means they have to then do the probability thing, or they put down some other cause of death. And what we're left with, Hilary, is an extremely... If this was one of our relatives, and we were just told, you're an excess death, but we can't be sure how your loved one died, how your mum or dad or grandmother or grandfather died, because we haven't got a system that has enabled us to do that. That, to me, is shameful.
I know that care homes differ, I can tell you that, and I can tell you that some have one GP looking after all the patients, some have different GPs looking after individual patients. What I would say is that it's wrong to portray a picture where all the elderly are being discarded. I mean, we've had Tom Moore, now Colonel Tom Moore, over nearly 100 years... No, he's at 100 now, isn't he? Just past his birthday. And he was praising the NHS at the age of 100 for his hip replacement and his
sure, but he wasn't in hospital with COVID-19.
No, but he was treated in hospital and he had wonderful care, which is why he did his walk.
Sorry, we're not knocking the NHS.
We are treated well.
No, Hilary.
No, we can't take this out of context and say all elderly people are being discarded, because I don't think that's true.
Actually, I think you're taking it out of context. You're now pivoting to a general observation about the NHS, which I think has done an amazing job for many, many years, whilst being, I think we agree, chronically underfunded.
Absolutely.
I'm not talking about general treatment of people like, Colonel Moore, who've had amazing treatment that saved his life. We know that goes on, and we have amazing people working in it. This is a very specific issue. Another email here, Kim on email. I'm a practice nurse in a doctor's surgery. Believe me, doctors are not visiting care homes at present time. I mean, that's 3 on the bounce now.
Well, I'm very surprised to hear that. I would like to hear from the care homes where doctors are visiting. And I can assure you that death certification is treated very seriously. And
I know. I spoke to his registrar, and she was very, very concerned that because doctors are not doing what they would normally be doing in many cases, it is impossible to actually be clear on death certificates. And many people's lives are being ended on a certificate with something which is probably not their cause of death. Her belief is, and many registrars' belief is, many of those deaths which are going down as random causes of death are COVID-19. And the reason it matters, Hilary, is that the volume of deaths dictates our assessment of government strategy and policy, doesn't it? Because if we are way out of kilter, as it appears to be, with almost anywhere in the world, serious questions have to be asked about the decision-making that went on.
Well, the way to compare statistics with other countries is to look at the excess death rate. We've already mentioned that's estimated to be somewhere between 50 and 60,000.
And with the exception of
similar
Italy,
time period in the last few years.
Right, with the exception of Italy, we're second worst in Europe. Italy, the only reason Italy at the moment can't be included, we only have a certain number of their excess deaths reported, I think, to the middle of March or something. So when we get their full figure, most of the experts who've been crunching these numbers now for weeks and weeks and weeks and weeks on the FT and now the Times, they believe that we will be quite comfortably the second worst excess death toll in the world and the worst in Europe. And that, I'm afraid, people can spin these numbers any way they like. That will be a national disgrace.
Yeah, but it doesn't tell you why it's happened. And it could be because we have one of the most obese populations, one of the most elderly populations, and amongst the densest populations of countries in Europe.
Or it could be that a dense population like Germany, like France, for example.
France has twice the geographical area.
Yeah, but Paris is just as dense as London.
Yeah, but the whole country isn't.
No, but I know, but this density thing, again, the people that have crunched all these numbers, they've drawn a conclusion. These issues are not that relevant to the numbers. And there's vast amounts of detail they've shown on this. There are dense, South Korea is incredibly dense. It's had hardly any deaths by comparison to us. I mean, you can compare and contrast to suit an agenda.
Well, New Zealand isn't dense at all, and they've had very few, very
but the one thing
numbers.
You can't get away from, Hilary, the one thing we can't get away from is if we are number 2 on the excess deaths in the world, that is a disgrace, isn't it?
Well, it could be because we're keeping elderly people alive longer than other countries.
Come, Hilary.
No, you've got to look at the other side of the argument. And
I'll hear it. But come on, you really think that's the reason?
Is a tragedy, but we don't know the answers yet, and we can look at it and say it's awful, it's terrible. What we need to do is do something about it. We need more testing. We need more tracing. We need therapeutics. We need a vaccine. And you know, we've got one of the best healthcare systems in the world, I think, and the NHS staff have done a fantastic job.
All right.
This is a really nasty virus that attacks the vulnerable, the elderly, people with pre-existing conditions, the obese, men in particular, healthcare workers, and you know, we can look at what's happened, but we weren't ready for this, and it's a pity we weren't, but that's why we've lost so many people.
Got a few more emails here. Claire on email. I work for the ambulance service. GPs are sending crews out to COVID patients in care homes. We haven't seen a GP in a care home since this started. We are a service seeing COVID patients.
So that's down to the paramedics.
EE on email. I work in a care home. No GPs are visiting. We're filling up with hospital discharges. My clients have dementia. No idea of social distance. We cannot keep them in their rooms. Ugo on email. You're absolutely right. Doctors refuse to visit the care home I manage. Confirmation of death was done on the phone after the care staff confirmed the rest of us. That is 7 or 8 now, Hilary, in the last 10 minutes.
I'm very surprised.
Right, but you see, this is the thing. I think the government is surprised too. The government doesn't seem to know. Yesterday, I had to watch Alex Sharma.
Alex Sharma, the business secretary.
The business secretary, who I think the bar is very, very low, but is one of the worst performers.
He was the government minister doing the briefing yesterday at 5 p.m.
He comes out with sort of ridiculous stuff. He suggested that care homes should